Yo, you didn't hear that. Hey, and in today's video, we're gonna go over the cardiac cycle. Medical? Honestly, I am pretty interested in medical stuff. Medical major, maybe. But this looks like a pretty simple video today. Okay, so we're gonna go over the anatomy of the pump or the heart. So, a structural one-way flow. So the valve mechanism. So the heart utilizes four specialized valves to ensure unidirectional blood flow. The atrioventricular valves, the mitral and the tricuspid, prevent backflow into the atria during ventricular contraction, while the similar valves, the aortic and pulmonary, prevent backflow into the ventricles during relaxation. These valves are passive gates that respond strictly to pressure gradients across them. And here's like the anatomy of the heart. You can kind of see like the words. This is my best. This is my best figure. I'm not gonna lie, because it's kind of cut off, but it's not even my fault, it's Jerry's fault, so I don't know what I'm saying. Okay, so the electrical now this is a good graph. But the electrical triggers, so the conduction hierarchy. So the SA node is the primary pacemaker and it initiates atrial depolarization, which is the P wave, and the AV node introduces a critical 0.1 second delay following allowing the atria to empty before ventricles contract. And now the bundle of the HIS or the Purkinje fibers rapidly distribute the signal to the apex for efficient bottom-up ventricular contraction. And this electrical sequence is the prerequisite for the mechanical event of the cardiac cycle. So you want to pause and like take a look at this figure really quick, because it's better than my figure in my first one. So I get a couple seconds to scroll. Yo my, oh my, huh? This is weird. Hold on. Okay, yeah, so we're back. So now we're gonna go over the atrial systole. Okay, so the atrial kick. So this is a late diastole, which during most of diastole blood flow passively from atria to ventricles, and a roughly 70 to 80% of ventricular filling is passive. And then we have active contraction, which the atria contracts systole following the P wave, contributing the final 20 to 30% of blood, known as the atrial kick. In the max volume, at the end of this phase, the ventricles reach their max volume, termed the end diastolic volume. Next, we're going to go to the isovolumetric contraction. Okay, so first, the S1 is where it builds pressure. So all valves close. As the QRS complex triggers ventricular contraction, intraventricular pressure rises sharply, and this pressure immediately exceeds atrial pressure, which snaps the AV valve shut. This closure produces the first heart sound, S1, often described as a lub. And then, because the similar valves are not yet open, the ventricle contracts with a fixed volume, hence isovolumetric. This is the highest rate of pressure increase in the cell cycle. And if you want to look at this, this is a really good one. Damn. Yo, I'm giving Jerry a raise. You know what? Should I call him right now? I'm gonna call him. Hold on, let me call him. I'm gonna call him. You know what? He deserves it, bro. Deserves it. Let's see. Yo. Jerry? Yo, your figures, yeah, actually really good. Aren't you in Fiji right now? Shouldn't you be enjoying your vacation? Oh, oh, you came home early? Yo, why? You need this job. Okay, so it's fine. Okay, so next we're gonna talk about the ventricular ejection. So this it first opens with the similar opening. So once the ventricular pressure surpasses the pressure in the great arteries, about 80 millimeters Hg in the aorta, the semilunar valves are forced open and the blood is rapidly ejected into circulation. This rapid ejection is about 70% of the blood and is moved in the first third of this phase, sorry. And then we have the stroke volume, which is the total volume ejected, which is around 70 milliliters. And now we have the ventricular pressure, which reaches its peak of around 120 mm Hg during this active work phase. And you can look at this graph again. It's a really good graph. Okay, now we're gonna move on to phase 4, which is the isovolumetric relaxation, where the pressure plunges, which is the S2, and this is the diastolic transition. And as the T wave marks ventricular repolarization, the muscle relaxes and pressure plummets. And when ventricular pressure falls below arterial pressure, blood catches the semilunar valve cuffs and it snaps them shut. And this creates the second hot sound S2, or the dub. So it goes lub dub, lub dub, lub dub. Yeah, you can tell I'm not going to be a doctor because, I'm stupid. But the ventricles is, again, a closed chamber with a constant volume, and as pressure falls towards zero, it allows for the next filling cycle to begin. And now we're going to go over the Wiggers diagram, which is, this is the master diagram, and it integrates the electrical events, the ECG, mechanical events, volume, and the hemodynamic atrioventricular and aortic pressures. It illuminates that pressure flow is driven by pressure differentials and valves open when the pressure behind them is higher than the pressure in front of them. You can see it in the background if you want to pause. I don't know, I tried to fade in so it's cooler, but okay, now we're gonna talk about the cardiac output and the final metric. So it's about 5 liters of blood per minute. Is that right? There's no way. That's a lot. There's no way. The hemodynamic efficiency, which is the cardiac output, is the total amount volume of blood pumped by each ventricle per minute. It is the product of the heart rate and the stroke volume, as you can see here. And the stroke volume is calculated at the difference between maximum and minimum ventricle volumes. Okay, so any questions? Just questions leave in the comments, and then I'll try to answer them to the best of my abilities. We still have a minute around. Let's see. I'm thinking about anything I did in AP biology that relates to the heart. But I don't know. I feel like AP biology just repeated everything about the heart that I learned in regular biology. Maybe that's why some people said regular biology is actually harder than AP biology. But they didn't have to wake up at 4 a.m. I'll give you the master study plan that I did for AP biology, right? So you're just not gonna study until the day of the exam, right? And then you go to sleep at 11, right? And then you wake up at 4, right? And then you just study for 4 hours, and then you go take the exam. Or you study at 11 to 12, right? And then you take a 1 hour 30-minute nap. So that's one whole REM cycle. So then you feel energized, and then you go study for another hour, and then you go do another hour 30, and then you keep repeating until the exam, and then you're gonna be cooked. But it's fine. Okay. So it's the image sources. Yeah. So I hope you learned something today, and I'll see you in the next video. Bye.